L3, L4 disc bulge or L3, L4 disc herniation is more common than most people think. In fact, it can cause not just low back pain, but can also cause symptoms into the thigh. So in this video, I'm going to give you 3 of the best exercises you can do that may help relieve the symptoms associated with L3, L4 disc bulge. Now stay right to the end of this video because I'm not just going to give you 3 L3, L4 disc bulge exercises, but also give you a bonus relaxation tip that you can do to help the lower back. So stay right to the end. And also I'll give you some indications of some of the associated symptoms and referral patterns of L3, L4 disc bulge. Hi, I'm Dr. Walter Salubro. I'm a corrective care chiropractor in Vaughan, Ontario, Canada. And what this channel is about is giving people tips and strategies on how to strengthen and stabilize the back. Like this, you can bend, move, and lift normally without pain and limitation. As well, I introduce my audience to corrective chiropractic techniques and methods. So if you want to see these techniques and methods in action, you want to learn about the specific strategies you can do to strengthen, stabilize, and stretch your lower back and get it stronger and healthy again, do subscribe like this, stay in the loop, follow me on my channel, and click on the notification bell. Like this, you'll miss out on my weekly video updates. So if you have an MRI report that shows multiple disc bulges, typically the common areas are going to be L4, L5 disc bulge or L5S1 disc bulge. But I've read many MRI reports from my patients and people send them in to me, and there's also damage at L3, L4 present. So an L3, L4 disc bulge, just like that, will actually irritate the nerve that comes out between L3 and L4, and that's the L3 nerve. And the symptoms associated with an L3, L4 disc bulge can be local back pain at that L3 vertebral level, right? So in that upper lower back region. And if I press in there, there'll be point tenderness in that one spot. As well, the nerves, when they're irritated, will give referral patterns to the inside thigh. Okay, so the upper inner thigh would be like a numbness and tingling sensation around the groin area as well. That's the most common symptom presentation that I've seen with an L3, L4 disc bulge or disc herniation. And let me tell you, I've seen many people in my office with disc bulges in the lower lumbar spine, and even an L3, L4 disc bulge can have a tremendous amount of pain and inflammation and limitation. I had one patient that came in, she had to be walked in with her spouse, support on her. She was literally dragging her leg and had so much back pain at that L3, L4 area that I discovered later. And it was confirmed she had an L3, L4 disc bulge, and she had also inner thigh groin pain as well, numbness and tingling. And we adjusted her as a chiropractor. We do adjustments. And of course, we have to do a thorough examination, an assessment, an X-ray analysis, MRI if required in some cases. And everything pointed to the indications that I could adjust her. I adjusted her sacrum, her lower lumbar spine, and she'd sometimes need an L3 adjustment as well. And that gave her a tremendous amount of relief, And she relieved her pain within a matter of weeks, less than basically 2 months. So she was back on her feet and walking normally, working normally all over again. So in this video, I want to give you some exercises that can be done at home. Now, these exercises should be done under the supervision of your doctor, your therapist. So don't just jump into them. Make sure you're clear for these exercises, but talk to your therapist, your doctor about them and see if they're good for you. And they may help relieve some of the irritation, limitation at that L3 area, maybe even relieve some disc pain and also some nerve pain associated with the L3 nerve that comes out from L3, L4 disc bulge area. They're mobility exercises, and stay right to the end because I'll show you an actual relaxation exercise that will be very useful as well. Let's get right into the exercises. There'll be 3 main exercises. Stay to the end because I'll also show you a 4th bonus exercise, and then stay right after that because I'll give you the dosages and repetitions and how many times a day you should do them. So exercise number 1 will be a standing extension exercise, but there's going to be a specific thing you have to do for this. You're going to use your thumbs and you're going to place them around the L3 area. So here's your rib cage. Right here, the bottom of your rib cage is going to be T12. Go down about maybe 2 centimeters, 1, 2, and then that'll be approximately the L3 area. Essentially, you don't want to be at the bottom at the L4, L5 area. So my thumbs, L3 area, and use it as a fulcrum point. So you're isolating L3 area. And you can do some standing extensions. Now, if this causes pain, do not do it. If it triggers thigh pain or leg pain, do not do it. Also get cleared by your healthcare practitioner before you do that. It's very important. But if it doesn't, then it may help relieve some symptoms. So fulcrum point, thumbs, L3 area, and very gently standing extensions. Very gentle. Just start with easy range of motion first. Make sure you get a nice extension. Pivot and use your thumb as a fulcrum point. So it feels good. You may even go a little further. You don't have to poke in with your thumb. You're just using it as a resting, bending point. That's it. Feels really good actually, even when I do it. So it's standing lumbar extensions with L3 fulcrum point. Now, exercise number 2 will be very similar. Fulcrum point at L3, but we're going to do side to side lateral bending. See if you can get some relief in that inner thigh pain. The relief may be bending to the same side or maybe relief bending to the opposite side. Most likely will be to the opposite side. So find your L3 area, okay, like we showed you earlier, and then you're going to put a fulcrum point there and do a lateral bending. So you're isolating that L3 area. Again, do this only if it causes relief. If it causes pain, do not do it. Local back pain increased or thigh referral numbness tingling increase, do not do it, or leg pain, do not do it. And get cleared by your doctor. So very gently, side to side. Feels actually very good because I'm isolating that L3 region with the fulcrum point of my thumbs. And just mini lateral bends. You don't have to go too much down. Very gentle, okay? Exercise number 3 is going to be cat-camel mobilization, a great overall lumbopelvic mobilization, and it's going to help that L3, L4 area as well. So get on your hands and knees in a quadruped position. I'll use my bench here. Just like this. Cat-camel movement. Round the back, arch the back. Feels very good. And bonus exercise number 4, baby pose. Get down to baby pose position. Give relaxation to that lower back region throughout the lumbar spine and your lower back muscles. That's a great sequence of exercises for the L3-L4 area to help with L3-L4 disc bulge. Now, I want to give you a couple extra tips here. So when can you do them? Once a day is fine, like in the morning, and even twice a day is fine, so morning and evening. With the extension ones, do about 10 repetitions. If you can do more, up to 15 or 20 of those repetitions, okay? With the side-to-side mobility, same thing, 10 to 15 to 20 reps. And with cat-camel range of motion exercise, even 10, 15, or 20 repetitions can be useful as well. And baby pose, as obviously for as long as you feel is necessary for you to give you that relaxation in that lower back region. Now tell me which exercises you're going to try first. Tell me which ones you like best. Is it going to be the mad cat or cat-camel exercise, or is it going to be the standing lumbar extension exercise with the L3 fulcrum? Let me know in the comments below. Any questions, also comment below, and do subscribe to this channel. Like it because it helps with the YouTube algorithm, and go ahead and share it with your family and friends. And then go check out this video over here where I talk some more about L3-L4 disc bulge. It's very popular on my channel. Check out that video right here to continue learning on my channel.